Hello there. My name is Chris and I'm with the Rocky Mountain ADA Center. In this video, I'll be covering a simplified version of an academic research paper by Dr. Jill Bajak of the University of Northern Colorado and the principal investigator for the Rocky Mountain ADA Center. This is the intersection of disability and food insecurity, challenges and solutions. A quick disclaimer. The information in this presentation is intended solely as informal guidance and is not a determination of your legal rights or responsibilities under the ADA, nor binding on any agency with enforcement responsibility under the ADA. The Rocky Mountain ADA Center, operated by the University of Northern Colorado, is funded under a grant from the National Institute on Disability, Independent Living, and Rehabilitation Research to provide technical assistance, training, and materials to Colorado, Utah, Montana, South Dakota, North Dakota, and Wyoming on the Americans with Disabilities Act. Food insecurity rates are significantly higher among adults with disabilities. In 2021, 28% of households where an adult couldn't work because of a disability were food insecure. The food insecurity rate was 24% for households with employed adults with a disability compared to just 7% for households without a disability. Very low food security rates were much greater for households where an adult couldn't work because of a disability compared to others living without disability, 13% compared to 2%. Low food security is defined by the United States Department of Agriculture as a situation where individuals report a reduced quality, variety, or palatability of their food options. Very low food security occurs with people who have multiple indications of disrupted eating patterns and reduced food intake. Food insecurity is associated with lower levels of physical and mental health status, as well as higher rates of emergency room visits and hospitalizations. Food insecurity rates among adults with disabilities vary quite a bit based on the type of disability, age, or gender of a person. People with physical disabilities often face higher rates of food insecurity due to mobility issues and higher medical expenses. Those with cognitive disabilities can experience higher rates of food insecurity due to the challenges in managing their own finances or accessing food assistance programs. Some people just won't qualify for food assistance programs because their disability isn't considered severe enough to make them eligible. Younger adults with disabilities tend to have higher food insecurity rates when compared to older adults. This is partly due to younger adults having lower employment rates and less financial stability, while older adults tend to have exclusive access to retirement benefits and specific food assistance programs. Women with disabilities are also more likely to be food insecure than men. In 2021, 6.5% of women lived in families experiencing food insecurity compared to 5.2% of men. This difference can be attributed to gender wage gaps, higher rates of single parenthood, or caregiver responsibilities. All of these imbalances highlight the need for specific interventions that address the particular challenges faced by different groups of individuals within a community. The Americans with Disabilities Act is a federal civil rights law that prohibits discrimination towards individuals with disabilities. The ADA can impact food insecurity in a few ways. Title II of the ADA prohibits discrimination based on disability by state and local governments, including state and local food and nutrition services. Also, a recent final rule updated Title II of the ADA to require state and local governments to ensure web content and mobile apps are accessible to people with disabilities. Title III of the ADA require businesses and public facilities, including food banks, to make reasonable efforts to provide access to people with disabilities. Despite the protections of the ADA, barriers exist to accessing food and nutritional services, which include physical, economic, information and digital, social, and policy or program barriers. Title II of the ADA requires public transportation to be accessible for people with disabilities, but limited service and poor compliance continue to be a problem. Difficulty with transportation is significant for people living in rural areas because public transportation options are limited. Inadequate access to reliable and accessible public transportation can make it hard to travel to grocery stores, food banks, and food service programs. Although Title III of the ADA requires businesses and public facilities to be accessible, many grocery stores are not designed with access in mind. This can make it difficult for people with disabilities to browse aisles, reach items on shelves, or use checkout counters. People with disabilities often face a higher cost of living due to medical expenses, which can further limit their food budget. Accessible food options, such as prepared meals, can also be more expensive. Title I of the ADA prevents discrimination based on disability in employment. However, employment rates of individuals with disabilities as compared to those without are 22.5% and 65.8%, respectively. Lower employment rates and wage gaps contribute to financial instability for individuals with disabilities, making it harder to afford nutritious food. Information about food assistance programs, nutritional guidelines, and food delivery services may not be available in accessible formats, even though information in Braille, large print, and accessible digital formats compatible with screen readers are requirements of Titles II and III of the ADA. Along with inaccessible formats, limited access to the internet or digital devices can also hinder the use of online grocery shopping and delivery services. People with disabilities often face social stigma and discrimination, which can affect their ability to access food assistance programs or receive help from community resources. Social isolation, especially for those with severe disabilities, can also limit their ability to seek help or access community food resources. This can also impact their motivation to shop for, prepare, or even eat food. Existing food assistance programs may not fully address the needs of individuals with disabilities. Programs may have eligibility criteria that exclude certain types of disabilities that are temporary or episodic or are not even considered severe enough to qualify for federal programs. Existing programs may also not provide sufficient support for those with greater food and nutrition needs. SNAP, the Supplemental Nutrition Assistance Program, provides money to low-income households for food, and participation in this program has shown to reduce food insecurity by 30%. Individuals with incomes less than 130% of the poverty income level can apply to this program. A recent study found 4.2 million low-income U.S. households were food insecure and included someone with a disability. Of those, 1.4 million were not participating in SNAP, and the other 2.8 million were food insecure despite participating in SNAP. Inadequate benefits to cover all food costs, high living expenses, limited access to nutritious food, and other barriers to getting healthy foods are reasons why people may experience food insecurity despite participating in SNAP. Another study investigated barriers that may prevent individuals with disabilities from participating in SNAP. Those findings suggest that SNAP programs should provide increased flexibility in the enrollment process, be less difficult to find information on SNAP websites, and for websites to be more accessible to people with disabilities. The application processes for food assistance programs can be complex and difficult to navigate, especially for those with cognitive or intellectual disabilities. Title II of the ADA requires that public programs, like food assistance programs, should be accessible to people with disabilities. However, lengthy applications and inaccessible formats can make it difficult for people with disabilities to navigate systems like SNAP, the Supplemental Assistance Nutrition Program, and WIC, Supplemental Nutrition Program for Women, Infants, and Children. The next part of the paper covers public health implication and policy recommendations based on the current literature to address food insecurity for people with disabilities. The first is to include individuals with disabilities in the discussion around food access needs, instead of assuming their needs without involving them in the process. Emergency food assistance programs, like food pantries and soup kitchens, can request assistance to improve physical access to buildings, which are often not organized to accommodate mobility disabilities. Streamline the processes of food assistance programs to meet the needs of people with disabilities. The health of individuals with disabilities may be affected by food availability, lack of food, if they need food to eat when taking medication, or to follow a specific diet. The last recommendation is for legislators and policymakers to increase their knowledge regarding the effect that public policies have on addressing food insecurity for individuals with disabilities. A call to action. There is an urgent need to address food insecurity of individuals with disabilities within the Rocky Mountain region. Providing information about food insecurity levels for people with disabilities would assist with developing trainings and hopefully influence public policy help. A call to action. There is an urgent need to address food insecurity of individuals with disabilities within the Rocky Mountain region. Providing information about food insecurity levels for people with disabilities would assist with developing trainings, such as how to apply for different food assistance programs, and hopefully influence public health solutions. It's critical to understand the access barriers that exist within the region related to food support programs, food banks, etc. A needs assessment investigating these issues would also assist in identifying barriers and future opportunities. Thank you for staying with me to the end of the presentation. The Rocky Mountain ADA Center is part of the ADA National Network. Our mission is to provide information on the Americans with Disabilities Act to individuals and organizations throughout Colorado, Utah, Wyoming, North Dakota, South Dakota, and Montana. The center is available to assist anyone seeking to understand their rights or for organizations that want to understand the responsibilities under the ADA. We are one of 10 regional ADA centers. The Rocky Mountain Center serves Region 8. To reach our center or your respective ADA center, all you have to do is call 1-800-949-4232 and you'll be routed to your regional center by your phone's area code. My name is Chris, and this was the intersection of disability and food insecurity, challenges and solutions, knowledge translation edition. Thank you.